Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about the 5 biggest myths when it comes to knee replacement surgery. Hey everyone, so today we're talking about the 5 myths or the 5 top myths or misperceptions when it comes to knee replacement surgery. So these are my top 5. Obviously, there's probably some different ones out there that you might hear from a healthcare provider or for someone who has gone through the knee replacement process, but these are my top 5, and I'm going to say them and then I'm going to explain them and help give clarity of what the actual truth is behind them instead of the misperception or the myth. So number 1, your amount of osteoarthritis or arthritis that's shown on your x-ray is going to determine whether you need knee replacement surgery or not. And the thing to think about with x-rays is they are just one part of the picture, one part of the bigger picture in determining if surgery is right for you or not. One thing to keep in mind is when you have an x-ray and it shows some level of arthritis and changes to the joint, these changes in this arthritis doesn't necessarily correlate with your pain and symptoms. So for example, someone who has very little or moderate arthritis might have very significant pain and symptoms. Someone who has very severe arthritis on their x-ray might have very minimal symptoms. So it doesn't necessarily preclude you, if you have little arthritis on the x-ray, to not have any pain. And the same token, if you have severe arthritis, it doesn't predestine you to have a lot of pain and discomfort and make surgery the only option. There's, of course, a lot of different options available. So things that are more important when you're thinking about, is surgery right for me? You want to think about your symptoms. You want to think about what symptoms you have. How long have you had these symptoms? How much do they impact your quality of life and your ability to do the things you want? And then also, of course, what have you tried? What conservative treatments have you tried before trying surgery as kind of that last resort, that last option? So those are kind of the more important things when determining if knee replacement is right for you. Myth number 2, recovery from surgery is about 6 to 8 weeks. This has a little bit of truth involved in it. So typically when you think of physical therapy, outpatient therapy after a knee replacement surgery, you're thinking 6 weeks to maybe on the higher end 12 weeks, maybe 16 weeks for a few people, but typically like within that 6 to 12 week time frame. And that is the normal, first of all. There's also some people who need much more therapy than that and stay in therapy a little bit longer than that, which is perfectly okay. The thing to think about is when you're being discharged from outpatient therapy after your surgery, you're most likely not going to be at that 100% I'm fully recovered feeling. It's more likely that you're going to be discharged. You're probably going to feel like you're at that maybe 80 to 90% recovered. You still have some pain, you'll still probably have some stiffness, some swelling, some things like that. Maybe not fully back to all of the activities and things that you want to be able to do, but you're well on your way to that recovery, but you kind of haven't gotten that last 20 to 10% maybe of recovery. And that can take a pretty long time to achieve in some cases. Some people, maybe it's up to 6 months after surgery. Some people, it's common and normal, maybe it's up to a year or 2 years, and in some cases maybe even a little bit longer to really feel like you're totally recovered. So that saying that recovery is 6 to 8 weeks, well, maybe your physical therapy might be that long or maybe just a little bit longer, but the actual recovery is probably going to be much longer. So that's something to keep in mind and keep perspective about. Myth number 3, you'll have to spend a long time in the hospital or in an inpatient rehab facility after surgery. So an inpatient facility such as inpatient rehab or short-term acute rehab or a skilled nursing facility, for example. So thing to keep in mind is the trend more and more is One, after your surgery, after your stay in the hospital, is to be discharged directly home. In the vast majority of cases, this has been found to be most beneficial, most effective. Patients enjoy it more. So being discharged home rather than to an inpatient facility. The other thing to keep in mind is that there's more and more trying to spend as little time as needed in the hospital. So for example, we have now outpatient or ambulatory same-day knee replacement surgeries where you're having surgery and going home that same day. There's also instances where maybe you're not spending those 2 or 3 nights in the hospital, but maybe just 1 night in the hospital as well. So more and more the trend is not spending a long time in the hospital, not going to that inpatient facility, but getting you home quickly so you can start your recovery. Of course, there are some cases where people will have to benefit and it's appropriate for them to go to a hospital or stay in the hospital a little longer or go to an inpatient facility. But more and more the trend is get you home, get you started on recovery, where you're home, where you're comfortable, where you have that support. Myth number 4, your knee replacement implant doesn't last a long time and surgery is very risky. So first of all, knee replacement implants are lasting longer and longer. There's probably a ton of different reasons for this, but there's improved surgical techniques, there's improved, implant design and specificity and customization of the implants. There's improved surgical techniques and management strategies, so preparation before surgery, both by the patient and the physical therapist and the surgeon's office. There's the improvement in techniques surrounding the surgery and the stay in the hospital, and of course with the recovery, rehab, and management after knee replacement surgery is improving more and more. So this leads to implants lasting a lot longer. You see anywhere from people saying 20 to 25 years. I've seen people say that on average they last up to 30 years, but the idea is they're lasting longer and longer. Surgery is risky. Yes, there are risks involved with surgery. There's risks with any type of surgery where you're receiving that trauma, where you're getting, your knee is basically being cut open and you're having trauma occur to your knee. And of course, there's anesthesia involved, which has risks involved. But the thing, in the same way that implants are improving, the same reasons are why the risks of complications or problems with knee replacement surgery are decreasing and decreasing. Things like preparation, planning, surgical techniques, surgical management strategies, and of course, recovery, rehab, managing the patient and the knee after surgery as well helps reduce that risk, that the risk of any serious complications or serious problems is very, very low. The risk is there, but it's very, very low. And I feel like decreasing more and more as we get better and better at the surgery and managing people after knee, both before and after knee replacement surgery. Number 5, your activity and lifestyle will be significantly limited after surgery. And I think actually the opposite of that is your activity levels, your mobility, your function are actually going to improve after surgery. I mean, that's the point. You have a knee replacement surgery is because you have these symptoms, you have this pain, this discomfort, this stiffness, decreased mobility, and you're getting a new knee to feel better, to decrease those symptoms, and be more active and be able to do the different things. Now, you have to keep a good perspective. You have to keep realistic expectations. You're not going to be running around on a football field. You're not going to be playing soccer probably, but there's many, many things that you can still do after your knee replacement surgery. And in most cases, you're going to be able to do much more than you did before surgery. There's people who are skiing, playing tennis, gardening, hiking, walking. Some people are even jogging a little bit. So there's lots of opportunities out there to be active and have an active lifestyle after knee replacement surgery. So those are my 5 big myths when it comes to knee replacement surgery. I'd love to hear your feedback. If you agree, disagree, If you have questions, let me know. If you're watching this on YouTube, be sure to subscribe so you can catch all of my videos, all related to knee replacement surgery, preparation, recovery, the surgery itself, frequently asked questions, all sorts of different topics. Thank you very much for watching, everyone, and take care.